Cancer. Cancer is the second most common cause of death worldwide. 10 millions of people lose their life every year. But one third of the most common cancers are preventable. Cancer is just a comma or a pause, but not a full stop. I, Dr. Angelina Dias, Director of Livewell Physiotherapy Clinic, would like to increase awareness about the fear and misconception of cancer. Today, on the occasion of World Cancer Day, we are fortunate enough to have with us Mrs. Vanisha Gandhi Bhatia. She is a homemaker, a fashion influencer, fitness enthusiast, a drummer in make, and also a warrior, a survivor, in totality, a superwoman. Welcome, Mrs. Vanisha.
Thank you for having me here and loads of words you have used for me. Hi everyone.
Early detection, screening, and interventions can improve outcome by providing care at the earliest stage. So, Vanisha, can you please tell us how did you get to know about your condition?
Dr. Angelina, you're very correct in saying early detection is actually the key word. If you come to know about it at the earliest, then you have won half the battle actually. So you have to be really alert and conscious about your body, about your fitness, about everything, so that you come to know about it on time. It so happened one fine morning when I woke up in the morning, I just saw a very small dot of blood on my night dress. But being very alert and aware, I used to keep on scrutinizing my body myself all the time. I just looked down on my breast and I could see the blood over there. So that is how I became alert, and I just went to my gynec, and so the kind of tests and everything started from there only. So I got it detected at a very early stage, and that helped me throughout my treatment.
So, it's very important for us to listen to our body signals, understand
Yes.
the warning signs at the earliest.
And here I would like to add, you should never ever ignore if you see something unusual happening in your body. And in fact, you should go for the medical advice as soon as you can. It helps always.
Yes. Cancer can happen to anyone at any age, be it any gender, race, culture, no matter who you are. So, I would like to understand, Vanisha, what was your lifestyle before you had this condition?
Regarding my lifestyle, I was kind of leading a very disciplined lifestyle. I was into my fitness regime very regularly and very religiously. I even own a yoga center, and I myself have learned yoga for 6 years, and I was into strength training. What not? I used to have a balanced food. I'm a total teetotaler, purely vegetarian. But it was bound to happen, so it happened. So only thing is you have to face it and move ahead with it with all the strength and the support from family and friends.
Yes, you truly said it right. So, Anisha, tell us more about your journey during the treatment, after the treatment. How did you overcome? How did you face this reality? What happened?
See, it's a long journey, there's a no doubt, but you have to be really strong and just keep on moving. Take one day at a time, one step at a time, and you will be through it, and you will be here sitting like me. When the cancer is there, chemo and cancer, they go along together only. And when chemo is there, the big question is your physical appearance, your hair, your eyebrows, your eyelashes. I will tell you, you are going to lose all these three: the hair, the eyelashes, the eyebrows. But you have to accept it and keep on moving. The day you accept all these, your journey will be, just remember, your journey will be much easier, and you will sail through it smoothly. So chemo was tough, but after one or two chemos, I was like accustomed to it, that what all problems I'm going to have, and I moved on. But you have to be very careful and very vigilant about your physical activities here also during the treatment. The doctor asked me to continue with my physical exercises a little bit, and but I was like reluctant to go out. During chemo you tend to catch infections, so I kept on walking for 20 minutes in the morning and also in the evening inside my house only. Like, I wanted to maintain the weight, because the weight increases and the dose of chemo also increases, and so the side effects of chemo increases, which I didn't want. So I continued with the physical activities and ate the food well, the balanced diet, and all these things pulled me out of this deadly disease, as people say, but it is no more a deadly disease. You are not going to die with it. It's just a comma or a pause, but it's not going to be the end of your road or your life.
So, Manisha, tell us, was there any physical problems that you were having? Was there any kind of a weakness or tiredness that you were facing?
People tend to have the weakness and tiredness, but I was fortunate enough that I didn't have to face any such issues. And moreover, one very important reason is because I very religiously followed what the physiotherapist asked me to do post my surgeries and during my treatment. So it really played a very important part in keeping me fit and going back to my fitness regime.
Yes. And also, not only physical exercises, right diet, nutrition,
Yes,
and
of
her
course.
disciplined lifestyle really helped her the way she is now.
The positivity also helps you a
Yes,
lot.
the thinking, your spirituality, your faith, your belief,
The willpower.
really the willpower can really make you the more of a positive person. Thank you so much, Manisha, for sharing your story with us. So, before we leave, can you just give us all one final message?
Yeah. So the word cancer has can in it. So it's my strong belief, if I can do it, if I can overcome it, all of you out there can do it and will do it for sure.
So, beautiful story from a beautiful woman. Cheers to life.